Yeah, greetings, greetings. I want to talk about teething problems in babies. Or should I call it teething fever? What is teething fever? Teething fever is a kind of fever that has been associated with teething in babies. A kind of fever that has been associated. Here, what happens is that the baby, 6 months, 7 months, 8 months, start growing teeth or start developing teeth or these teeth start budding out. Uh, what now happens is that the child start having fever. So many mothers will say, the child is having teething fever. They will now be running up and down trying to look for anti-teething medications to give to the child uh, to help relieve the temperature that the child develop. But I hope you know that a child is not supposed to develop fever because the child is teething. Yes, the child can have pain, right? The child can have pain quite all right because there is inflammation of the gums, and also once the teeth protrude through the gums, the child can have pain and it can be painful. That one is true. So the child will become restless, fussy, crying unconsolably, right? Having sleepless nights, right? Now, that is different from fever. Fever is a systemic condition in which your body temperature will go the baby's body temperature will go up, and it has nothing to do with teething. What happen why your baby develop fever during teething is this, during that time your baby start developing teeth, it's the same time, right? Your baby is the oral phase. It is called the oral phase of your baby, in which your baby want to put everything in the mouth. Your baby sees this handkerchief, put it in the mouth. Anything your baby sees a remote, a TV remote, we put the a remote controller, we put the remote controller in the mouth. That's also the time your baby start trying to move by himself, especially for those baby that have started crawling. Those baby that have started doing some things by themselves. So anything they touch inside the mouth, right? They see sand inside the mouth. They see thread inside the mouth. They start licking anything their hand touch is inside their mouth. Even if they touch their diapers, if they can pick their diapers from the ground, they'll put it inside their mouth. Because of that, and you also know that the baby's immune system is not very strong as at then. A baby has a very weak immune system. Right? The immune system is not very strong as at then. So what now happens is that there will be contamination of the mouth and if the leading to infection. That's why the baby start developing fever. That's why you associate it with teething. It has nothing to do with teething. It's because of the oral phase. Go and check. Most babies have fever in the oral phase or oral stage of their life because they put everything in their mouth. It's also the same time they will start having catarrh. That's the time they also like putting things inside their nose, in their ear, and the rest. So instead of you blaming the fever your baby is having to teething, could it be that your child is having upper respiratory tract infection? Your child is having otitis media, ear infection. Could it be malaria that your child is having that is making you think that your child is having a teething fever? You will now go and be buying all those anti-teething medications that can affect your baby's kidneys. You don't know it can affect your baby's kidneys and liver too. You don't know. It does. Oh. So that's why I've come out clear to say don't give your baby any anti-teething medication. If your baby is having complaints from his teething, and you notice that if you look at the gums, you see that the gums are red and inflamed. You can take a white and clean napkin, right? Put it in napkin or sterilize handkerchief. White. I prefer white because if it is dirty, you will easily know. You put it in warm water and use it to dab the baby's gum. You see that the baby will calm down, the baby will feel better, the baby will sleep well. You don't even need to wait for the baby to start crying. At interval, you can be doing it 3 times a day, especially when you notice that the baby has started growing teeth, right? And the baby is feeling fussy and the rest, not sleeping. You just take warm water, clean water, put your clean napkin inside, squeeze it dry. I didn't say burn the baby, oh. Or just put it right and use it to dab the gum or massage the gum. I didn't say peel the gum of the baby, oh, because some of you are too aggressive in anything you do. Just use it to dab it little by little. I didn't say burn the lips of the baby, oh. Use it to dab it little by little, little by little. You see that your baby will feel fine. So there's nothing like teething fever, right? It's because you just like saying toilet infection. Toilet infection is not a medical word, right? If you get what I mean, I don't want to dab into that. So you say when you say teething fever is not a medical word. It just mothers have over time uh, name giving that kind of fever name, giving teething fever during teething name that they now call it teething fever. It does not mean that the child develop fever because the child is teething. The child is probably having eye infection, ear infection, throat infection, right? Because of the things the child is putting inside the mouth and the rest. Child can also have catarrh. The fever could also be coming from malaria, could also be coming from pneumonia. So consider all these things so that you treat what is appropriate instead of going and be giving your baby teething medication that can harm your baby.